Hello, I am County Executive Stuart Pittman, Anne Arundel County, and I want to welcome you to answering your COVID questions with Dr. Nilesh Kalyanaraman. I should note the date today because the news changes quickly in this arena these days. It's August 25th, Wednesday afternoon. So we have not, Nilesh and I, Dr. Kalyanaraman, gotten together and had a town hall-like event where we answered questions from the community in, I believe, a couple of months because we felt like there wasn't much news to convey and much had changed, but that's not the case anymore. So we all know that the Delta variant is well over 90% of the cases and that the Delta variant does in fact spread faster than the previous variants of COVID. And not only does it spread faster, but vaccinated individuals can carry the Delta variant and spread it to others. While not at as high a rate as vaccinated individuals, it does happen. So that's changed the approach somewhat. We've changed the approach during this pandemic every time either the virus has changed or new discoveries have been made. And so that's one of the reasons why we all feel a little bit like, wow, this ain't over yet, and it's really a depressing kind of a conclusion to come to. The good news on that is that when we look around the country and the world, there are places that where the news really is quite bad, and those are always the places where vaccination rates are lower. So the states that are down in the 50% range are seeing huge numbers of cases and particularly hospitalizations. And that's where we hear the news of hospitals being overwhelmed and getting back to that point where they're having to turn away people who come in for other conditions. And we're fortunately in a much better place, both in Anne Arundel County and in the whole state of Maryland. But it's troubling that despite our vaccination rate of, we're up to 80% for folks 18 and over. We're over 70% for folks 12 and over who are eligible. It's a lower rate for the whole population because there are still those under 12 they're not eligible. But it's concerning that despite all of that, the case rate has increased significantly in the last month. And earlier in August, you may have remembered, I made an announcement that because of the beginning of the case rate growing, we've complied with the CDC guidelines that when you get to substantial spread, which is a case rate of average daily case rate of 7 new cases or above, then folks should mask when they are indoors in public places with others. And we did not institute a requirement for that. We did not have the legal authority to do so. In Anne Arundel County, our emergency declaration no longer exists. We could reinstate that emergency declaration with 5 of 7 votes on the county council. I could reinstate it for a week, but that would have to be, that wouldn't do much unless the council supported with a supermajority extending it beyond that. So there are conversations taking place about that. I'm not that interested in a political theater of conflict at the county council if we're not gonna get anything done. But the conversations are ongoing, and it may be that we have a unanimous support for taking action at the county level. But we did take action that I do have the authority to take, which is in county buildings. It's required now that masks be worn whether vaccinated or not when folks are in the same room with one another. Disappointing move, but a necessary one. The other move that we made is to require vaccinations for all county employees unless they take a weekly COVID test showing that they're negative. So that is all underway. You've seen that happening around the state and around the country. You know that just this week, Pfizer was given full use authorization by the FDA, which is great news. It should remove some of the hesitancy that some have had about the vaccination. And it also has an impact on businesses and local governments and all employers who are now, you're seeing more and more of them requiring vaccination for their employees because it's fully, it's past that final hurdle of being full use authorization. I hope that there will be more of that, more private businesses. We've seen in our county, the Annapolis Symphony, for instance, said that everybody who attends their concerts must be vaccinated or have proof of a recent test. I've seen a lot of private events requiring the same, and I think you'll see more and more of that as well. So yet another reason to get vaccinated. We are going back to school very soon, and it's disappointing to some, but I think necessary that the superintendent is requiring that, with the health officer's recommendation, requiring that all staff and students be masked in our schools. We've seen around the country that if students are not masked and there's an infection in a class, students who've been close to that person in the class without masks need to quarantine. So that means the class ends up being closed. We want to keep our classes open. We want to keep our schools open. So the masking requirement does not. It means that folks don't need to quarantine if they've been in a classroom with another student until they test positive, if they do. So we will be doing a lot of testing in our schools. Most of our teachers and our staff are vaccinated. I know there are conversations about requiring it in the school system. They are not part of county government officially, so it's a separate order that would have to come down from the superintendent to do that, and that's under discussion. But the good news is we're moving forward. The numbers can only go up in terms of vaccination. This thing is spreading at a rate where if you're not vaccinated, you are very likely to get infected. And I personally believe that I think there's a real question about whether we're continuing an upward trend in cases or whether we're cresting and will come down. And I'm very hopeful, but I don't expect to see the kinds of restrictions that we had in the past on business activities or gatherings. It's possible because things could change with this virus, but if things are as they are with this Delta variant, I think we can be optimistic about the future, and we just have some work to do to get these last folks vaccinated. So I will turn it over to Dr. Kalyanaraman for an assessment of where we are with some numbers, and then we have a number of questions that some of you have emailed in already, as well as you can put questions in the chat on Facebook. They'll be forwarded to me, and I will try to get to as many as possible. We're going to get this done within 30 minutes, so let's keep it moving. Dr. K.
Thank you, County Executive. I just want to pick up where you left off. What we're seeing with the Delta variant is that it spreads faster and causes more severe illness. And so while we've done a lot of things right, we were really good about masking. We've been really good as a county about getting vaccinated. There's still more to go. What's changed is that the virus has changed on us. And that means that we have to then respond in kind. How do we know it's changing on us? Well, we see that, we got to our case rate of less than 1 per 100,000 people about a month and a half ago. That was fantastic. But Delta is now close to 99% of the cases in the county, in the state, sorry. And we see our case rate has been rising. It's up to 17 now. More importantly, our hospitalizations are rising. We've got over 50 people hospitalized between hospitals, and Arundel Medical Center, Baltimore Washington Medical Center. And that's really what we're looking at, right? What's the most severe consequence? That and death. And last week we saw 6 people die, which is the most we've seen die in a week since May, since we were coming off of that surge from the UK variant. That's really concerning. And with the level of hospitalization we have, we don't want that to go higher. It's really important that while we still have a lot of people who need to get vaccinated, particularly those kids who can't, that we control the spread of this. There's a couple of things that'll help us. Obviously, the FDA approval of the vaccine. I hope those who are waiting for that, it's occurred. Please come get your vaccine. But it is also really a good trigger for businesses to require it. The safety of your staff and then the safety of your customers as well is really dependent on that. And we think of it very much as what we do with flu vaccines in the healthcare sector and in some other sectors. It's just a common part of what we do. And we want to see the COVID vaccine be just like that. And then the third dose, the recommendation by the CDC for a third dose for people with severe immunocompromised, so people with transplants, cancer, advanced HIV, or who are on immunosuppressive drugs or have primary immunodeficiency. those are the people that really do need to get a third dose because their immune systems are not as efficient and effective. So they need that extra dose to stimulate antibody production. So with that, I'm going to stop there and then let's get to some questions.
All right, well, I'd like to ask a question related to what you just said about the immunocompromised folks. And you know, a lot of people wonder whether they are immunocompromised and where the line is drawn, and then for the third dose. And then I know that at 8 months, they're talking about, you know, Pfizer and then Moderna being calling for a booster. And then there's the question of those who got Johnson & Johnson, which the information's not out because it was authorized later. But what do you do if you either believe that you need a shot or your doctor thinks that you need a booster shot? You've been vaccinated, fully vaccinated, and it's been a while. If you attempt to make an appointment at the health department sites, will you be accepted?
Yeah. So if you think you need a third dose or your doctor does, you can come to health department site or to any of the pharmacies that are offering it and get your third shot. We're not trying to screen people out. We're taking people who believe they need that third shot. I think the important thing to remember is that if you're immunocompromised, it's really going to help you. If you're, as you talked about, if you're getting close to the 8 months since your second dose, it's likely to help you. If you get it, you know, a month after your second dose, it's not going to do much for you. So that's really the reason that we're talking about 8 months. That's not an official recommendation yet, but that's really where the conversation is right now.
Okay. Let's see. On testing, we know that there's going to be demand for more testing, particularly some of the employers if they're doing a mandate with testing requirements if you don't get vaccinated. And then in schools, one would suspect if we're like other jurisdictions, we'll have outbreaks and there'll have to be a lot of testing done. What's the plan? Is the health department going to be able to keep up?
So let's do the schools first. So at the end of the last school year, health department, we were doing diagnostic testing. So people who had symptoms, we were doing the testing, and we're going to continue that in this new school year. We're also working with the school to stand up screening testing. So trying to find cases before they start to spread, and that'll be launching as well. For everybody, while the health department certainly has capacity, there's also a lot of capacity for testing in the healthcare system. So between urgent cares, doctors' offices, there's a lot of, and pharmacies, there's a lot of testing capacity. So we want people to go wherever it's easy and convenient for them, and that can include the health department.
Okay, I have not been giving the names of these folks. I think we got to Christy and Jen's question in one, and Hayden's as well. But here's one that from Andrew. Now that Pfizer has full FDA approval, will we see more vaccine requirements? And specifically, let me add to that, if I were a business owner and I was thinking about requiring my employees to be vaccinated or my customers, but I had questions, who do I call? Are there resources available? I want to cover myself legally. I want to get some advice.
Sure. So the couple of things that businesses can do. One is that at the health department, we're working on guidance to provide, and so you can call us for that assistance. But also, most places have somebody who helps them with their HR, and that'd also be a good place to turn. These vaccination policies are pretty much, as I mentioned earlier, are pretty much what we do with the flu vaccines. And so we're modeling them very much on that existing model that's been there for decades.
Okay. Here's a question that I know has been asked by parents or considered. Do masks compromise children's breathing? And on that, if you could add, if you have any impressions about how children have dealt with masking, since we're going to be sending our kids to school and they're going to be wearing masks all day, and how did that go?
So yeah, so first question, do they impede breathing? They don't. So when you're wearing a mask, oxygen is able to get in, carbon dioxide gets out. As a reminder, Healthcare professionals, surgeons do surgeries for hours on end with a mask on. It doesn't compromise your breathing. Now, it might feel uncomfortable and the air might feel warmer or more humid than you're used to, but that's not the same thing as compromising your breathing. The second piece is that around kids have by and large done really well. Now, remember, kids are used to all sorts of rules and uh, guidelines of how they're supposed to behave, what they're supposed to do, whether that's in daycare or schools. And they are just as good or just as bad, however you want to say it, as adults, and sometimes, tugging their masks to the side or whatever. But by and large, what we've heard from schools is that kids keep their masks on. I think it's important as adults and as parents to reinforce that message for kids. They may not like it. I get that. But that's not the same as saying that they can't wear it. We all have to take some safety measures, and that's going to keep them in their seats and learning in school.
Yeah, I can speak from a little experience because I have twin boys who just turned 12, and they just got for their birthday their vaccinations, and they're very excited about getting the second one and being fully vaccinated. But it's because they're really, they've heard a lot and they're concerned. And I've been shocked at how willing they are to put their masks on. And I've asked them, I said, what's it like all day at school back in the, last year at the end of the year? And they really don't seem to mind it as much as I thought. I think they're more adaptable than some of us grownups. And I have heard more complaining from the parents about masking than the kids themselves. So hopefully that'll go okay. I was at a school this morning, and the teachers are really excited to actually have all of the kids in the classroom and not have to teach to a camera for kids at home who often don't even show their faces at the same time trying to teach to the class. And so I know teachers are thrilled, and the mask is a small price to pay to get the kids back in and keep them back in. Actually, on that, I know that the protocols for contact tracing and quarantining are complicated to keep a track of, but can you describe the difference between with and without masks in a group, in a classroom, in terms of who quarantines?
Yeah. So I think one of the biggest things to know is that the 6-foot guideline is still in place in general. So if you're closer than 6 feet to somebody who's a case, you're considered a contact. But in the classroom setting, it's a little different. In order to get kids back in, and given what we've seen, if you're within that 3 to 6 feet, which pretty much when all the kids go back in, there's going to be a layer of kids about 3 feet away from, your child. If both the person with with COVID and the contact are masked, the contact does not have to quarantine. And so masking is going to be really key in terms of keeping kids in classrooms so that they don't have to then go home, miss days of school, and then parents have to be home, take off from work. And so masks are key to just keeping everybody on their schedules.
So if I'm vaccinated and two scenarios. One is I've been somewhere where I noticed there were a lot of unvaccinated people, and I thought maybe, or maybe I had one more beer than I should have, and I was a little loose in my, in my masking or something. Should I consider just getting tested to see, and at what point? And also then if I start to feel some symptoms, like even just a cough or a sniffle, should I still get vaccinated? Should I still get tested even though I'm vaccinated?
So if you've been somewhere where you think there's a lot of people who aren't vaccinated, or there's really not a lot of proper mask usage going on, our recommendation is to get tested 3 to 5 days after that event. That's going to be the window where if it's going to show up, it's going to show up, and you're going to catch it quickly before it starts to spread to other people. In terms of symptoms, we're heading to school, and all our parents know that kids start coming home with something, right? They start coming home with some colds as soon as they start mixing, and then the weather's going to get cooler. If you have symptoms, we still want you to get tested to make sure it's not COVID, even if you've been vaccinated. And make sure you stay home or keep your kids home when they have symptoms so they're not passing it on to others. Now, if you don't have COVID, you can return to whether it's school or work once your symptoms are dying down. It's not the same, with COVID, you do have to stay home for a longer just so that you don't spread it on. but it's how we're going to keep ourselves and others healthier during this challenging cold and flu season with COVID.
Okay, here's one from Paula, and I'm not sure if she may have, well, you can answer. I've heard that a person must have 8 months between the second vaccine and the booster. I received a text from the Department of Health that said at least 28 days after the second vaccine. Can you clarify this?
Sure. So there's two different reasons to get a booster. One that is a CDC recommendation is if you're immunocompromised, severely immunocompromised. In that case, you're not really developing the immunity that you need to after 2 doses, and so you should get your third dose 28 days after your second dose. Now, for everybody else who's generally okay, fairly healthy, that's where the 8 months comes in. And while that's what the president was talking about, that's not an official recommendation yet for the 8 months. But it looks like things are headed that way. And that has more to do with the fact that over time, your immunity kind of starts to slowly drift downwards. And that's truly just a booster, kind of like the way you do a yearly flu shot. Plug, if you don't get your yearly flu shot, now's a really good time to start. If you do, it's coming soon. But just in the same way we do yearly flu shots, getting these booster COVID shots is the same idea. After a while, your immunity starts to drift down. You need another shot just to boost it back up again.
Is there any reason not to get your flu shot at the same time you get your COVID shot or booster?
You should absolutely do that. And you can get both your flu shot and your COVID shot, whether it's the first time or the booster, you can get those both at the same time.
Okay. Is there a test for the Delta variant? This is from Shannon.
Mm-hmm. So there is no direct test. The PCR and the rapid tests don't test for the Delta variant. Those tests then have to be sent to special labs that take anywhere up to a week to identify what type of variant it is. So there isn't a way to tell from the usual tests whether it's a Delta variant or another variant.
We can be pretty sure it's Delta if it's over 90% of the cases, right?
At this point in Maryland, yep, it's pretty much you have Delta if you have COVID.
And hopefully it's not Lambda, which is the next round, right?
You know, we haven't seen Lambda, at least I haven't seen any evidence of that in Arundel yet, but we are absolutely keeping our eye out for that.
Okay. And while we're on that, what do we know about it?
You know, we don't know too much about Lambda. We do know that it's a variant. We do know that it is worth watching, but we really haven't seen much of it in the country, and we certainly haven't seen it really make a significant appearance in the state. So I think at this point, you know, there's talk about Lambda, but there are actually a lot of other Greek lettered variants out there too that are circulating in the country. So the CDC, the State Health Department, ourselves, we are keeping track of these things to see what's their characteristics, how much do we have to worry about them, and then is it making an appearance here? So as we know more, we'll certainly share that.
It's great to have a professional to help us filter what we read, because the news is always looking for the next big story, and sometimes it's not always the next big story. So hopefully it's not. Hopefully Lambda is not a big story. Now that we are in the CDC high level, what, if any, new recommendations does Dr. K have for schools?
So for schools, actually, it just makes the universal masking that much more critical. All of the steps that we have been talking about in terms of safety, in terms of the masking, the vaccination, and really pushing on the vaccination, both for teachers, staff, and for students who are eligible. The ventilation we've been talking about since day one. And then there's going to be testing, the screening testing, and the diagnostic testing that we talked about. Really, all of those measures are what we need to do. And I know that there's been quite a lot of some very strong feelings about masking in both directions, but I think the direction we're going as a county really makes the case that now is the time we need to put those protections in place to keep kids in the classroom. So I think that we have all the tools. We need to apply them and apply them consistently throughout every school.
And correct me if I'm wrong, but the state school board may be mandating all school districts to mask at their Thursday meeting.
I know that the state school superintendent said that that's what they would like to see, is that universal masking in every in every county in the state. So I do hope that the state school board does that.
Yeah. Right now, I believe about 2/3 of Maryland counties have already said on their own that they will require masks. So, okay. And then with regard to school, this is from Kara. What about the children eating in the cafeteria? What will their risk be?
That's a great question. So I think this is a good point to talk about. We try not to talk about things being risky or not risky. We talk about how do we reduce risk or what activities increase risk. So part of the reason to have universal masking is to recognize that things like eating or instruments where children can't properly wear masks, those to decrease the risk of those events, that's why you need to be masked at all other times. That's also why we're doing screening testing, because we do need to have kids eating. They need to eat lunch, they need to eat breakfast. And so what can we do in every other situation to decrease risk, to make the lunchtime less risky? So I think that's fine. And all of these other steps we're putting in place will help make that safer.
Okay. And here's one that I actually skipped over in the beginning, but I'm going to go back to. I think I probably skipped over it because I've asked it of you so many times. I know the answer, but when will they authorize the vaccine for children under 12? Please.
So,
can you hurry them up?
I assure you. So I have a 10 and an 8-year-old, and I told them that the second it's proved, they're getting pulled out of school and they're coming with me to work. Right. So we've been hearing in the fall, and actually just, I think yesterday or the day before, the head of the NIH said that it's probably looking like it's going to be later in the fall. And he said towards the end of 2021. So that's pushing it out a little bit later into the fall season than we had hoped. And so, I wish I had better news than that, but I think it's taking a little longer for those studies to come in.
So the timing on these things, full use authorization for kids, is totally dependent on data that they're waiting on, right?
Correct. So the way it works is that these studies have a certain amount of data that they have to collect in order to then be able to say, okay, we want an emergency use authorization or we want a full approval. And that really depends on how many kids are signed up and also what the rate of spread is in those communities. So interestingly, if there's low amount of spread, as there was over the summer in many areas, it actually takes longer to collect the data. If there's a lot of spread, the data comes in more quickly. But I think that what we're also seeing is that they need to make sure that they get the safety data back as well, right? With the children, as with any of these studies, that's important. So they just want to make sure they have all of that together to then put forward.
So we have 3 minutes left. I want to ask you one more question of my own, and then we can both say something to close if there's anything that's been missed. But let's just go with closing statements, actually. I'd be opening a can of worms. So I mean, is there anything that you think that we've missed that you want to make sure that people keep in mind as we move forward?
I think we know what we need to do, and we have the tools to do what we need to do. We know that we need to wear a mask when we're in public settings indoors, get tested if you think you've been exposed, get your vaccine, avoid crowded areas. And so as we're confronting Delta, it isn't a question of what should we do, it's let's do the things we know how to do and let's make sure we all do it so that we can be safer.
And I would just close by saying that, I listen to everybody. I respect everybody, and I basically serve everybody as county executive. And I don't agree with everybody on COVID. And there's been a lot of opposition to a lot of the work that's been done to try to stop the spread of this virus. And I would just remind people that, throughout the history of this country, and every country, but this country in particular, I think there are things that have taken collective action, and it's sometimes when we're being attacked or when we're in a war, or and people step up. And in terms of infectious diseases, I don't think a lot of us would be alive had our parents and grandparents not been vaccinated against various diseases that the science came up with vaccinations for. So it's I just encourage people to take a deep breath, look at our history, and take a second look at all of this. I think you've got people who are coming around who politically might have taken a position that was different. I mean, even Donald Trump encouraged people at a rally to get vaccinated the other day. He got booed for it, but he said it. He said he got vaccinated and worked hard to make sure a vaccine was available during this pandemic. And so this is just not a political issue. It shouldn't be. It should never, ever have been. And damn it, we have to stop making it one. So my hope is that on our county council and with our local electeds that we can all work together to finally be done with this and then move forward. And we can bicker about a lot of things, but let's just not bicker about this. Just, you know, the doctor's orders are the doctor's orders. So thank you, Dr. Kalyana Raman.
Thank you.